Thank you once again for an overwhelming response for the ongoing webinar series on specific learning disorders. Today is Thursday, and once again, we are back with another webinar from this series on the same time at 4:30 p.m. Today, we'll be talking about support systems for children with specific learning disorders with Toby Philip Jacob. More about him a little later. Let me tell you a little bit about Ability, the organization that brings to you this webinar series. For us, as an organization, all carers of children with special needs, that is, special educators, therapists, teachers, and of course, parents, you all are at the center of our universe. Our mission is to make things easier for you. And when we say easier, we mean making it more accessible, making it more affordable, and most important of all, making it more effective for you all. One way we have been able to do that is through technology, because through technology, every child, we could make every child the opportunity to thrive. But technology alone is not sufficient, right? Technology could only offer the required support, and there are other support systems required, such as community resources, so that the child gets a an opportunity to discover their true potential. And that's what we bring to you. Ability brings to you community. Ability brings to you host of other resources which can enable discovering your child's true potential. One way we have been doing that, of course, is through our YouTube channel. So if you visit to youtube.com and search for Ability channel, you should definitely subscribe for it, by the way. There are hundreds of such videos which can prove to be useful for your child. Apart from that, our Facebook page also keeps you posted with all the updates regarding the events that Ability host, be it webinars, workshops, or any other things, so that you never miss an update from Ability, and also stay posted about all our upcoming events. Thousands of people are already following it. The link to our Facebook page and also our YouTube channel is being shared in the chat box right now. So if you haven't subscribed to the channel, or if you haven't followed the Facebook page yet, please do now. I am certainly sure that it would prove to be beneficial for you. Of course, like I was talking about the mission, that our mission is to make things easier for you. In lines of these mission, we bring to you webinars and workshops. Today's webinar is no different. It is a part of the ongoing series of efforts that we have been doing to spread more and more awareness for the foundational knowledge building of all the attendees. Apart from that, we have also recently started conducting workshops. The concept of workshops is a little different because it is conducted in a smaller group setting, and because of the smaller group setting, it facilitates more direct interaction with the speaker. And but yeah, the purpose is always the same, to be able to help more and more caregivers, and that's what we do with all our events. So, without any more delay, let us come to today's event. Like I already mentioned, today's webinar is the fourth webinar from the ongoing SLD series. We have already talked about the introduction, with the basic introduction, how to identification and diagnosis of SLD, and planning of instructions. Today, we'll be talking about support systems for children with specific learning disorders. If you're attending this webinar for the first time, and if you have missed on any of the past webinars from the series, or for that matter, you want to have a look of on any of the past webinars from Ability, you can log into the Ability platform, create an account of yours, and watch all our past recordings. In the ongoing series, however, we'll be continuing to discuss dyslexia, dysgraphia, and dyscalculia in the next three webinars in much greater detail. Hope you all get to learn a lot more today. And today in the experts, we have Toby Philip Jacob, who's the speaker for the day. He's a senior psychologist and remedial education therapist with an MPhil in learning disabilities and more than 6 years of experience in clinical psychology. He's a senior psychologist and program coordinator for professional certification courses at the Sashakti Trust, Cochin. He's specialized in assessment of children with special needs, remedial intervention, and behavior therapy. Thank you so much, Toby, for joining us today. We are so glad to have you here with us.
Thank you.
And also in the panel, we have Madam Geeta Gopi, who has been conducting some of the webinars in this ongoing series. So thank you, Geeta ji, for joining us. Happy to have you here.
Warm good evening to all. It's a pleasure to be here on this platform, and I am with my one of my colleagues. So yeah, it feels really good to be here today.
Yeah, great. Thank you so much, both of you, for joining us. Over to you now, Toby, if you could proceed with
Ye-
today's session.
Okay. Um, Good evening, everybody. Before I get into today's webinar, let's have a quick recap of what was taught last week. It means how the learning process took place was taught, the importance of holistic learning, and planning instruction. What are the things that we should take care of? The multisensory or the VAKT approach, then the instructional focus, how it should be in different kinds of settings. So when we look into today's focus, to our today's webinars, it is on support systems for children with specific learning disorders. So we have divided into two areas, the psychosocial aspect and the accommodations and modifications. So the psychosocial aspects has been divided into three areas. That means the behavioral area, the emotional area, and the communication area. So let's look into it in detail.
When we go into the behavioral aspects, we have to understand that children with SLD primarily have a lot of academic related issues and difficulties. Also, they have difficulties with skill sets that are required for academic achievements. And because they have struggles with this, many of their behaviors are also associated with academic difficulties and arise out of those.
So what happens is that they tend to show a lot of unwanted behaviors in the classroom. So what they do is they don't want to go to school at home. They don't want to go to school. They tell that the teacher is not good enough. That means they don't teach in a good way. We don't understand. Even they tend to skip classes and school at times. And some children even resist or refuse to do school activities or academic activities. That means all these in turn brings them up to give up easily. That means their self-confidence is lowered.
So, because of many of the behavioral issues, and when they keep persisting, sometimes we find that these result in emotional issues as well. Because of continued negative feedback or continued negative learning experiences, many of these children end up having low self-esteem. They may be very withdrawn and may not like to interact or get on with the peers, mainly because they cannot match up to their achievements. So this also brings about a high probability of loneliness. uh, Stress and frustration which they experience in learning, especially in the academic or school environment, or may also cause anxiety. A lot of pressure from parents, teachers, etc., to push them beyond their beyond their beyond their current functioning, without taking into account the support systems that they need, without understanding that they require certain kinds of supports or changes within the instruction and the school environment, also brings about a lot of fears which are related to examinations, tests, uh, higher order academic activities, etc. Some of them also end up having emotional issues, emotional illnesses, like like clinical depression, etc. This also, if these behavioral aspects, emotional aspects, including the academic aspects, if these are all left unaddressed, many of them end up having overall poor mental health as they grow up to be adolescents and adults.
So just as you have seen the behavioral and the emotional aspect, there might be some communicational aspects that has difficult, that the children with SLD might have difficulty. But basically, they might not have issues with functional communication. But when they are asked to express things in detail or elaborate things like what did they do around in the weekend, they might only be able to tell you that they went out. So the specifics or telling in detail might not be as simple as for them. And some children might face pronunciation issues. So, and some kids tend to have one talk so fast. That means I talk a bit fast. So likewise, there might be clarity issues. So you'll have to mm, manage them. So managing them is the most important thing that you have to do. That means you will have to put in behavioral management for management of the behavioral issues. Counseling and intervention can be used to tackle those issues with emotions, and speech and language training can be provided to reduce the communication issues. So looking into the behavioral management, what we can do initially is the preventive planning. So what is preventive planning? Preventive planning is to set up the environment in the best or the most apt way so that all these unwanted behaviors are not expressed all of a sudden or can be controlled to a greater extent. So that means you have to provide them with a positive learning environment that caters to their strengths and weaknesses.
Coming with the preventive planning, what we aim to do is to reduce the occurrence of several of these kind of behaviors. Having said that, many of these behaviors still may occur. So what do we do in those situations? In those situations, what we make use of is surface techniques. Surface techniques are basically less intrusive or less invasive techniques that we can use in the classroom, so that the child is not shamed publicly or rebuked or reprimanded publicly, but with certain visual cues or minimal instructions. There are several kinds of surface techniques that can be used to manage their behaviors in the classroom. So when the difference is, in preventive planning you're doing things which would prevent the occurrence of such a behavior, but in surface techniques, once the behavior is starting to occur, or we know it is occurring, then you can step in and use these strategies, which can help the behavior to be controlled and restrained to a great extent.
Yes. As we all know that children with SLD has average or above average intellectual functioning. So we can actually train them to manage their own behaviors through cognitive based behavior training. So we can teach them self-regulate their behaviors through certain coping strategies. So this can actually prevent a lot of negative behaviors. So just like the emotional and behavioral aspects, we have to control the emotional aspects also. So that's when counseling comes into place. So one-to-one counseling or therapy can be done for the child. Then cognitive-based training can also be done. So what happens is that we can actually train them to self-manage or monitor. That means teach them coping strategies to how to express their emotions in a better way or in a positive manner. That's what we can teach them to do. Then comes the personal family counseling or guidance. So that means family is the most important part of a child's life. So the family should be aware of the problem of the child and they should accept the condition of the child. That is three things: accept the condition of the child, encourage to take up support services, and have realistic expectations for the child.
So while we have already discussed behavioral aspects and emotional aspects, coming back to the communicative aspects and how to go about addressing these issues, speech and language training is what we use. More often than not, we have to take the services and input from a qualified speech and language pathologist for this. And usually what they tend to do, or the input that they give us to us educators, is how to work on the clarity issues in speech or the fluency issues. If they speak too fast or too slow, how to bring about an even speech, a speed of speed in their speaking. Vocabulary development. Vocabulary, many of the children with SLD are weak in vocabulary. They may not know, words with similar meanings. Their actual choice of words would be very limited. So, taking language training also helps with enhancing their vocabulary. Another major area where SLD children, many of the SLD children do need help is misarticulations. That is, they tend to mispronounce certain sounds or certain words, and they may need correction for that. So here again, correction for misarticulation again is an area that we need to work on, because all these communication issues ultimately also affect their self-esteem, how they project themselves with their peers, their socialization skills, etc. So it is very important that communication issues, even though it might look minor in SLD children as compared to other disabilities, it still needs to be addressed, because it really does affect their self-esteem and other emotional aspects and socialization aspects. Now, we've talked about the behavioral aspects, emotional aspects, as well as communication aspects. And even if we address and give supportive services in these areas, and despite the best educational practices that we may give, the remedial help that we may provide, all the behavioral supports and other communicative and emotional supports that we provide, still, to be fully functional within the school system, they may still need some kind of accommodations and modifications. In my earlier webinar, I had already mentioned what accommodations and modifications are and what the difference is. Just to refresh that, modifications are the changes that one makes to what the child is going to learn. That is, modifications are changes that we make in the content of the curriculum to enable the child to access the curriculum. Accommodations, on the other hand, are when we make changes to how the child is going to learn the content. So again, here we are talking about methodologies, materials used, strategies, etc. So the content doesn't change. The child will still be taking what the other children are taking, but how they access the curriculum, what activities are provided, or what materials are provided, etc., would be changed according to the needs of the child. And this may also include the use of technology. So nowadays, technology is a big factor, and where possible, we can always make use of technology to assist in providing accommodations and modifications. Accommodations. When we come to accommodations and modifications in many places, especially I can definitely say in India, a lot of the schools, a lot of parents, etc., even the educator community think that these accommodations and modifications are mainly for the board exams, but that is not true. As per the government rules and regulations, from the time the students are identified as having SLD, accommodations need to be made available to them. And there are plenty of accommodations and modifications that can be listed out, but today we'll be looking at some of the more important ones, or the ones that seem to be more relevant and to the classroom setting. What accommodations and modifications do is, these are additional support systems that help the children to achieve their true potential. And they're not set in stone, they're not rigid. Sometimes when the child starts off, the accommodations or modifications we give or provide the child with may be different. As the child progresses, and as the curriculum difficulty or student expectations at different grade levels changes, similar accommodations and modifications have to be similarly reviewed and modified. So it needs to actually change as per the child's needs, as per the curriculum and the grade level, and what are the student expectations required of the child. at different stages in the schooling. And a lot of times we get certain concerns from parents, from the school, from teachers, that when we provide these accommodations and modifications, aren't we doing an undue favor to these children? Aren't they getting an advantage over the other children? And aren't the regular kids being denied of that advantage? But the truth is, these children are already at a struggling stage. They already have a disorder within them, which means that they are not in the same plane as the other regular students. So accommodations are not meant to provide an unfair advantage to them. Instead, they are meant to level the playing field and to make it, make the curriculum easily accessible to these children with learning disorders.
So as you saw, what are the need for accommodations and modifications? The accommodations and modifications can be broadly classified into these 5 categories. So one is the general language usage, the other is the behavioral areas, the academic areas, classroom environment, and in assessment and grading. So let's look into some of the accommodations and modifications in these 5 areas. The general language usage. So what can be done is we can give instructions step by step. That means a detailed or a lengthy instruction can be shortened down into 1, 2, 3, 4, 5. That means breaking the steps into smaller steps. That can be done for them. Even we can provide them. Some children might require repeated instructions because they have a tendency to forget what the instructions was told to them. So we might have to repeat the instructions provided to them. And as we all know, they might have they might even take time to respond. That means what do you call, their thinking might not be as fast as other children. So we would have to give them time to respond.
Now, coming to the some of the accommodations and modifications that can be done in the behavioral areas, one thing is to acknowledge the effort that they are putting out. Many a time, some of these children may not be achieving their performance, may not be equal or on par with other children in the classroom, but at least they may be making a lot of effort to get to that level. So their actual performance may not be on the same level as the other children, but because of the effort that they're putting in, one has to, as an educator, reward them for that, reinforce the effort that they're putting in, because if not today, someday they will get there. So it is very important to acknowledge the effort and not just see the end product of the performance. It is important that the classroom also has a good behavior management reward system, use of reinforcements, positive reinforcements like social praise, giving points on behavior charts, etc. All these are good examples of how we can have a good behavior management reward system so that the child is encouraged to keep up with the positive behaviors. Some of the in the behavior management system, even in behavior charts, which is called token economy, you can also have a system built in called response costs. So if there are negative behaviors which they should not be doing and they're indulging in it, you can remove points as well. So you can give points for the positive behaviors, you can remove points for the negative behaviors, which is called response cost. That is, they are paying the cost of responding in maybe a negative fashion. So there are different kinds of behavior management reward systems that can be implemented within the classroom. Some of these children do have attention issues. ADHD is a comorbid situation seen in condition seen in many children with SLD. So they have an inherent need for movement. So expecting them to sit for long hours at a table or chair is not really wise on the part of an educator. So try to allow for limited movement within the classroom. This can be done in many ways. We can plan activities that require movement, which require them to stand up and move around. You can also do things like, if you have to pass books around in the classroom or erase the board, you can actually call on these children. So they get to move around in a positive way, in a way that is sanctioned or allowed by the educator, rather than they moving around and distracting the class at inappropriate times. Also, many of these children have difficulty focusing on academic related tasks for a long time, and they have fatigue because of this. And it is good to provide or breaks in between. So you can provide little intermittent breaks, especially between changeover from one period to the next period. Or you can, if you're within a period, if you're moving from one task or one activity to another activity, you can have a 5 minute or a 2 minute break. Sometimes even just standing up and doing a deep breathing can provide an intermittent break. Or just do a deep breathing and flare out their arms and stomp their feet and then calm down, breathe slowly and get back to their seat. So these kind of things can actually help in providing intermittent breaks, and can actually promote more positive behavior within the classroom, thereby reducing the negative destructible behavior.
Looking into some of the accommodations and modifications that can be done in the academic areas, like reading instruction to the student with a demonstrated example. Suppose that means you are giving the child 5 problems to do for a whole classroom. You can actually demonstrate or show how to do the first problem like an example. So this actually demonstrates or helps the child to understand how to do the assignment or assessment. So next comes the checking for understanding of instructions. Make sure that the child has understood what has been instructed to them. And even at times we can see that some children might require additional time to complete the task. So allow them that extended time on a limited basis, which you think is needed for the child. Some children might face a difficulty in studying science subjects or a second language. So what we do is we can drop that subject for the child, or waive off the subject for the child, and put off an alternative subject that is helpful or makes enough and more that is supportive for the child. That means which is effective for the child. So in that ways, dropping a subject can also be done. Even we can use audio text, because they have an issue with reading. We can use audio text or text to speech to overcome their reading difficulties. At times we can reduce the assignments or give alternative assignments. Like if the whole class is given an assignment to do on domestic animals, this child can copy images from the internet and also copy materials or matters that constitute information on domestic animals and submit it as their assignments. So that is a form of an alternative assignment. Likewise, even manipulative aids can also be used, such as a number line, letter line, or even calculators for doing mathematics can also be used. So continuing with the academic area, accommodations in the academic areas, we can allow them for spell check. How do you do a spell check is basically with the help of a dictionary or an online dictionary. That means you tell the child to check if the spelling is correct. That means you will have to teach them how to use a dictionary beforehand, but still, that is how you do a spell check. And they might have issues with copying from the board, because chunks of matters, the to and fro, looking from the board, writing on the paper. So why to give that unnecessary strain or stress to the child? You have a modern means of printing the matters, or even giving printing worksheets to them, that actually reduces the unnecessary copying and errors that they form from copying from the board. You can accompany oral instructions with written directions or with visual cues. That means give examples or at least highlight which are the areas that has to be, that means the instructions that is given to the child, that actually helps them to understand the instructions in a much better fashion. Nowadays, as we are told, we can use computers or even record written works. That means you can tell them, it supports the learning process. At times we have seen children with number and or letter reversals. So this number or letter line that is kept on the desk actually helps them to reduce the errors that they have might make through reversals. The next is, I will provide you with an example. I had a homework, or what you call a small diary set of papers that was kept in my pouch, that actually helped me to note down what are the assignments that I have to do today, what are the revisions that I have to do today, when is the next test paper coming up. So likewise, so these kids with SLD tend to forget the instructions that has been told to them on a later period. So what we can do is we can help them with the help of a homework diary that can be easily accessible for them, so that they can note down what are the assignments to be done, and what are the information that has to be told to the parents. Likewise, currently the font that we use in our textbooks are small, or not that suitable for children with SLD. So what we can do is we can increase the size of the fonts, and provide them with a user-friendly font, which in turn helps in better reading of the children. Likewise, in a classroom environment, what we can do is we can take the child and put the child in the front row. Keeping the child in the front row helps him or her to reduce distractions. So that means their concentration will be towards the teacher most of the time, and even the teacher will be able to attend to this child on a faster rate. So bringing them to the front row or closer to the teacher will be a good option to do. And even in certain areas, if the classroom is big enough, we can actually design certain areas like cubicles, which is used during for office works, to minimize the distraction. So a new pattern has been formed. That means pairing the child with a buddy pair. So peer buddy. So that actually helps in faster learning for the child. So that can also be done, and keeping them close to the buddy pair helps them learn on a faster rate.
Just as Toby has talked about all the academic areas and some of the things that can be done here, it has to be remembered that not every child will require each of these. Again, these are tailor-made for you have to look at each child's needs, what do they require, and put in accommodations and modifications that are required for each child. Coming back to the next area in accommodations and modifications, it is in assessment and grading area. So some of the ways we can make sure these children are, can access the assessment and grading pattern in schools is, for example, if they have written writing issues, or they're very slow in writing, or they know the answers but they are unable to put it in writing, you can allow for oral responses. You can take oral tests instead of written tests. Or for example, in the higher classes, you can provide a scribe, so the child can actually dictate the answers and a scribe can put it in writing. Similarly, nowadays a lot of boards also allow for the child can use a computer to type the answers, especially if they're older and they have typing skills. uh, Tests can also be taken in a small group or a special educational setting. In many of the inclusive schools, or they would have a special ed setting or a resource room setting. So allowing the tests or exams to be taken in a small group or a special ed resource setting is more comforting to the child. It makes the child more secure, it minimizes distractions, so they tend to perform better in those tests and exams. So this is one thing that can be taken into account while doing assessment and grading. Again, just as we talked with the academic area, allow for extended time if you think the child requires more time for completion of the tests or exams. Read and explain the test instructions. So, many a time the children have trouble with reading, so they may not know how to go about doing it. So an interpreter or a reader can be provided who can actually read and explain the test instructions to them. Especially if the instructions are multi-step instructions, you may have to break them step by step. Just like earlier Toby had talked about language, in the classroom language use, give simple instructions. So you can reduce or simplify the instructions and explain the test instructions to them. When giving MCQs or multiple choice questions, at least in the initial early classes, reduce the number of choices that are given. So when these children have reading issues, attention issues, writing issues, etc., when you give too many choices, say for the question there are A, B, C, D, E, almost five options given, it takes them a long time to read it, comprehend it, and then decide what answer to give. By then, a lot of time has been wasted. So when we start with MCQs, especially with the younger children, reduce the number of choices you give. So start with maybe yes and no, or two options, and then slowly you can start increasing the options as they grow and as they progress. Do not penalize the students for spelling or poor handwriting or poor presentation, especially if you're assessing for content. For example, if you're marking or grading a science exam, if the content of the answer is correct, if the scientific reasoning or the content of the answer is correct, just because the child has written in poor handwriting or his work is messy or there are spelling errors that is crept in, which is very characteristic of children with the SLD, we should not be penalizing them for this. Instead, we should focus on what the content is. And basically, what we have to do is we have to focus on what the objective of the assessment is. So, if that objective is met, then you can ignore the spelling and other issues and grade them based on the content. Also, when it comes to assessment and grading, we do not have to rely just on paper pencil tests or written tests. You can assess them in various ways. Basically, we have to just assess whether they know the concept, whether they've understood it, whether they can demonstrate their knowledge of the concept. So you can probably grade them on a project or grade them on an oral presentation, etc. So don't just base their grading on mostly paper pencil kind of tests. Use a variety of assessments. Also, you can design alternative assignments. Just like we talked about alternative assignments, alternative assessments can also be done. So if the child has reading issues and the rest of the class is doing reading comprehension, we can substitute that with listening comprehension. So somebody can read out the passage to the child, and then the child can actually answer the questions orally based on the listening of the passage. So similarly, many alternative assessments can be given, and that can be graded. And also, when we take into account a holistic or a cumulative grading, don't just grade based on their test scores or just based on their performance in examinations and tests or certain graded activities. Instead, also take into account their everyday classwork, the individual ability or the effort they put in. So all these can be given a certain credit in their grading system, and therefore they are actually, it projects what the child is actually performing, not just as the end product that they produce, but also the process, whether they are improving in the process and whether they're putting in the required effort and following these the strategies that you have been telling them. And a lot of times we find, especially in inclusive schools or schools which have resource room facility, grading does not have to be done just by this regular educator. You can jointly determine a grade, taking into account what the special educator's input is, as well as what the regular educator is doing. So from the assessment and grading should be a cumulatively determined by the regular teacher as well as the special educator, because the special educator will have a greater insight into what the child is actually able to perform, which sometimes they perform well in a specialized resource room setting, but they may not perform as well in a regular, large group setting. So, grades need to be jointly determined. Now, when we come into provisions for board exams, different kinds of provisions are given in different countries. So we have to look in, we are going to have a look at what are some of the board exam provisions in India and other countries.
Yes. Excuse. In India, the major board is CBSE, that is the Central Board of Secondary Education. So, what the provisions that they have provided is majorly extra time, as we know it, and they have also provided us with subject drop option, because kids can drop a subject and take an alternative subject. Even use of a calculator for children with mathematical difficulties are also provided. A reader, that means they previously had a scribe, but now they are only providing the support of a reader, and ignoring spelling and grammar errors. So these are some of the common provisions that CBSE provides. When it comes to NIOS, the National Institute of Open Schooling syllabus, they provide us with these children with the help of a scribe or even a reader. And extra time can be given to those who require it. And as in CBSE, ignoring spelling and grammar mistakes are also taken into account. So likewise, as in NIOS and CBSE, state boards also has certain provisions for children, for this one provide for children with specific learning disorders. But what is commonly seen is that they provide them with extra time. So all their provisions are updated every year. So make sure you go to their sites and check what are the provisions for them that comes up.
Now, coming to some of the most commonly seen international boards, many of the international boards also provide something called EAA, that is Exam Access Arrangements, and IGCSE actually also gives the provision of a scribe, reader, extra time is provided, more papers are modified. Some of the question papers are modified to suit children with SLD. Assistive technology is given, separate room where they can take the test so that it minimizes distractions, it makes them feel more secure. Rest breaks in between. So, you know, they can have intermittent breaks in between the, instead of taking the test at one go or the exam at one go. The IB schools, many of the IB schools are really good with accommodations and modifications, and it's not just with the board exams. In most of the IB schools, right from when it is identified, it is put in place. So again, here, use of scribe, a reader, or somebody to communicate, especially if there are language issues, extra time, use of computers, modified papers, rest breaks, etc., are provided. So we see that most of the boards do try and provide a lot of these accommodations and modifications. They keep revising them and updating them. So if a child is going to appear for for an exam from a certain board, it is advisable to go to their website and check on what exactly are those accommodations and modifications that are available for that particular year. So it is important to check if uh, the boards are actually provide what they are providing and what for that current year. So it is very important to go back to their website and keep yourself updated regarding what are the uh, provisions and accommodations that are being given and to children with SLD for the board exams. I think with that we really come to an end of this webinar. I hope this webinar has provided you with some useful information, and I'm hoping that in the following webinars we'll be dealing more or diving more deeper into the commonly seen learning issues, which is reading difficulties, writing difficulties, as well as math difficulties, and you know, I hope we've imparted some good amount of information to you all. Thank you.
Thank you.
Thank you so much, Geeta ji. Thank you so much, Toby. That was a very informative session indeed. I am pretty sure that all the participants here who have joined us are taking lots of learnings and valuable learnings here from us today. And to all the others whom I did see messaging in the chat box, if you have kids with autism or you know kids with autism, we have this ongoing workshop series by Gerd Winkler. I wanted to inform you all that the third workshop from the series is on the next Saturday, 10:30 a.m., where Gerd will be talking about managing rigid behaviors. We have already done the past two workshops on improving attention span and improving communication. And believe me, we have received fantastic feedback for the same. So I am pretty sure that you must be willing to attend this workshop. The link for registering for these workshops is being shared by our team members in the chat box. So if you are interested, please go ahead and register if you haven't registered by far. Also, to explain you more about the workshop, I think so it would be better if I show you a small video clip that can.
If your child hits you, they want to communicate something. If they hit themselves, they want to communicate something. There is something they want to tell you, right? So I am looking at all those rigid and agitated behaviors as a way to communicate. So I will teach you how to manage them and how to encourage your child to replace those behaviors with more verbal communication or with gentle non-verbal communications.
Yeah, so that was the workshop conductor himself. He has conducted past webinars in Ability, and I'm sure a lot of you must have already heard from him. So if you're interested in learning more from him directly and, of course, interacting directly with him, you would want to register for the workshop. Also, if you haven't registered yet for the ongoing SLD series, for which we are attending the fourth webinar today, the link for that is also being shared in the chat box. So please register for the ongoing series, and we will see you in the next few webinars where, like Geeta ji already mentioned, we would be discussing in much greater detail about dyslexia, dysgraphia, and dyscalculia, respectively. And without further ado, let us move to the questions. A lot of participants have asked us a lot of questions, Geeta ji. And the first one, and also the questions are for you, Toby. Feel free to answer if you have anything to add to what our participants are interested in knowing. The first one says, both of you did talk about surface techniques in today's session. So one of our participants wanted you all to elaborate on surface techniques. What do you mean by it? And if you could give some examples of surface techniques.
Geeta ma'am, please.
Yeah, surface techniques are, some non-invasive behavioral techniques. So one example is something called planned ignoring. So planned ignoring is if the child is indulging in some attention-seeking behaviors, something which is mild but not huge disruption to the classroom, but still the child keeps on doing it. As an educator, for an extended amount of time, you can kind of ignore the behavior so that it, once the child realizes that he or she is not getting your attention with this unnecessary behavior, that will come down. So that is one surface technique. There are several surface techniques like this. I'm sure with the ability workshops we'll be going more into these with our behavior management workshops, we'll be going more in detail into these. Another one is called proximity control, which we already talked about. See, there is a lot of overlap between all these. So one we talked about in the accommodations and modifications, that placing the child in a certain position in the classroom so that the teacher has better control. So when the teacher even senses that the child is probably going to indulge in an unacceptable behavior, you can go and have a, you can physically kind of restrain the child, or even sometimes even going next to the child and distracting the child from that prevents that occurrence of that kind of minimizes the impact of that behavior. So dissuading the child basically, so by giving more proximity to them. uh, so these are some of the techniques. Some of these, planned ignoring, proximity control is one. Another one is where you can actually provide them with something called signaling cues. So when you do signaling, what happens is, if the child is doing some distractible behavior, or is not focusing on what you're doing, or is playing around with something when the lesson is going on, instead of bringing calling out the child loudly in the classroom, you can actually give certain cues. I mean, I, for example, when I worked, I would have a set of classroom rules. The first one was sit properly. Second one was, follow, listen, and follow directions. So these the children were trained in. So when they're supposed, the child is not sitting properly, is slouching, or is under the table and all that, normally you just have to do the signal, one, and then they know, like, okay, that means sit up straight, or sit up in a good listening position. We can also give positive kind of instructions, where instead of saying don't do that, instead of giving a negative comment, you can say what the child can do instead. So if somebody is, say, not doing the work, or is basically playing around whenever you have set a task, instead of saying why aren't you doing your work, or I usually say, okay, let's get busy now. We need to get on with our work. So giving positive comments like this, giving positive instructions, so that the negative behavior is replaced with the positive one. So these are some of the kind of surface techniques that we can use. A lot of teachers, some of the very good teachers really use these on a regular basis, but sometimes it is indeed very difficult in a regular classroom to have huge number of children, and if there are one or two children really misbehaving or not doing what the educator is asking them to, it can actually disrupt the classroom, and it can go haywire. So it's very important that these kind of techniques are used consistently, so that you can manage your classroom better.
Sure. Hope that answers your question. A lot of people have asked us about surface techniques right now when I was going through the chat box. Interesting. Hope that answers all your questions, dear participants. Okay, moving on to the next question. This one we have from Rabindra. Rabindra is asking us if we can make parents participate in remedial teaching for specific learning disorders, and if yes, then how to do that.
Okay, parents can be a part of remedial training. In our clinic also, at times when parents are from distant places, we have included parents also. But parents should make sure that they don't disrupt the normal functioning of the child or the normal process of remedial teaching. Because some at times we have seen parents who, when the child is taught in a certain way in a remedial training, they go home and teach the child in a totally different way. So we would actually have to go hand in hand with the remedial training system. So if they go hand in hand, then there is no issue in accommodating them within the remedial training of the child.
Sure. So go hand in hand. Is there anything that you would like to add, Geetaji, to that?
What I would say is pretty much what Toby said, because sometimes children get confused when in the remedial session it's taught in one way, and in the when the parents go home and when they try to rehearse the same thing, it's a different way. So it's important to get the parents on board, show them how to do it, give a good demo, or they can sit in with some of the sessions and observe it and do the same at home.
Right, right. Okay, so the next question is from Dr. Risha Devdar. Dr. Risha is asking us if children with specific learning disorders have any provisions for government jobs, and what are the career opportunities in general available for children with SLD.
Okay. If given the right kind of support, the right kind of intervention, career opportunities, the sky is the limit. You only have to match the child to the child's you have to match the career to the child's interest and aptitude. So what the child is
Right.
good at, use those strengths and choose careers that that will match those kind of abilities of the child. If the child has has ADHD along with LD, don't expect to give a career which is a tabletop job, sitting at a table for long
Mm.
hours. So
Yes.
what is important is to choose a career which will actually utilize a child's strengths and interests and aptitudes. Coming to the government jobs part of it, yes, after the in India, definitely in the government of India in 2016 has actually increased the government job reservation. Earlier, it used to be 3% of government jobs for persons with disabilities, but now it's been increased to 4%. But in this, they have different categories. So out of the 4%, there's a certain percentage. I think it's 1% which is given to people with a visual impairment. It's and there's 1% given to those with locomotor and cerebral palsy and those kind of disabilities. And usually children with SLD, IED, intellectual disabilities, autism, mental illness, persons with mental illness, these are all categorized as one, and they all come under one benchmark disabilities. So if you go into the Government of India PWD job reservation website, you'll get the exact breakup. Uh, but most SLD is combined with, so don't lose out on it. There are reservations, but they are in. It's 1% for a host of disabilities together.
Right. Yeah, so a lot of people, and like you were saying, that sky is the limit. I definitely agree with you. And I think so, all members of Ability Organization would agree with you because that's what the motto says, raising aspirations of every child and not limiting it by anything or anyone. Moving on to the next question, we have this from Suman Chopra. Suman is saying that some children do not listen to teachers and disturb or beat other children of the class, don't write anything while they are in the class. But according to their parents, they are quite opposite when they are at home. They do everything as required. So, what is the reason for such difference in behavior and how to handle such children?
There can be different reasons. One thing could be because at home the child is in a one-on-one situation. It's not a large classroom. Okay, when it is in a regular classroom, there are so many children. The teacher's attention is divided amongst, so many X number of children. The large group dynamics, the distractions and noise level, etc. So much happening in a regular classroom. So the child feels overwhelmed, and that can cause these kind of behaviors. Uh, Also, there is another aspect to it. Sometimes there are parents who report that my child can do all this at home. Uh, and usually they come from parents who are in denial, because
Right.
many of them are not willing to accept the fact that their child has a problem, and they're still in that stage of denial, and they have to be gently taken through that process of getting to accept the child uh, with their strengths and weaknesses. So a lot of times this does happen. They say, oh, but the child can do everything at home. Oh, my child can add and subtract, for example, but the child doesn't do it in school, or the child doesn't do it in the remedial session. So then what we usually tell them is, see, it is not enough if the child is doing it with you. The real
Right.
test of any skill is when you can generalize it to all the situations that is required. So,
Definitely.
if the child is unable to generalize, there itself there is a difficulty in the child, because the child is not able to generalize. So that is how I kind of approach it with the parents, and I tell them it is important, it is good. Okay, if we don't know for sure what the parent is saying is true or not, so there's no real way of making it out, except that, yeah, after years and decades of experience in the field, when you know the child is simply not doesn't have that skill, or is way below that level, What the parent is telling is just a cover, they're just trying to cover up for the disability of the child, the disorder. So but then this is how we approach it, tell them that the child has to learn to generalize, and if the child is unable to generalize, then there itself you have a problem which needs to be addressed.
Definitely. So teach your children to generalize, and that's the problem that you will need to solve. Moving on to the next question from Siti Rojia. Siti is asking us, do children with specific learning disorders have trouble in sleeping? And whether it is because of feelings of anxiety, is it related to academics, or it is actually the influence of the disability?
What we have usually seen is that kids with SLD don't have issues with sleeping, but still, some children with anxiety uh, have sleep issues, and specifically kids with ADHD, they tend to have a lower sleeping patterns. So what happens is that they usually take a power nap, like and half an hour is enough for them. Half an hour sleep is enough for them to run for the whole day. So that should not be seen as a sleep disorder or an issue with sleep that the child with SLD has. But still, all these, because what we have seen is that children with SLD do not have any kinds of sleep issues, but anxiety or related to those emotional problems can bring up sleep issues.
Sure. Great. So, as much as I want to talk and keep asking questions, which all the participants have sent to us, we have reached the time limit. And so, I'll be taking just one last question. And I'm hoping that, dear attendees, your questions that you have been sending to us are getting answered or will be answered in our upcoming sessions or webinars or workshops. So, the last one from Dr. Deepa Singh is, how to deal with visual motor reflex integration issue. This is a particular issue that she has mentioned. If you could explain what this issue means and how to deal with it.
Uh, if I'm not sure I understand the question correctly, because reflex integration is an issue which we normally see in babies, neonates and early childhood, usually from 0 to 12 months, that is 1 year. Uh, and there are, that's a completely different area in itself, where there are children are born with certain reflexes, and persistence, certain reflexes should disappear at certain ages. If not, they hinder the certain developmental milestones. So that happens in most of the other disabilities. When it comes to SLD, this is not very visible, because children with SLD mostly do not have any very significant developmental milestone delay. Some of them do have a delay in speech and language, but again, that is, it's not that visible as it is in other kinds of disabilities. I think probably what she meant was visual motor coordination, which a lot of children with SLD do have. Sometimes they are not able to synchronize their visuomotor activities, and a lot of times we need to plan occupational therapy kind of activities for this. It's you know there are plenty of opportunities to do this. Basically, I'm tempted to use a Sanskrit sloka where we talk yata, we in the Natya Shastra, in the Indian dance tradition, they talk about where your hand moves, your eyes should go, and where your eyes go, your mind should follow, and so on. So this is basically the substance of visuomotor training, and this can be done through all kinds of ways. In every single activity, visuomotor coordination is required. Even if you're opening a bottle, you need to have your eyes and hands coordinate. So the opportunity is limitless. Involve them in all kinds of household chores, let them do all the kinds of things that are necessary. uh, Help the children to put cloth pegs on the clothing line in your house. That brings about fine motor. And if you can marry it with the academics, even better. I mean, I would do certain, to give an example, I would do, for example, if the child is learning how to count, so, they can actually pick up the beads and drop. Or you can give a flashcard with a number on it, and they can use clothes pegs to match the number and put the same number of clips while counting. So you're using the visuomotor, but you're also marrying it with the academics. So use
Definitely.
these kind of activities. There are plenty. I mean, any kind of self-care activities, household activities, even art and craft things, games, outdoor games. Many of these, all these require visuomotor coordination. So I think an educator's or a parent's challenge is how you can relate it to academic learning.
Right.
You can connect the two, well and good.
Yeah. And the way you put it, I do realize that practically anything and everything that we do requires visual motor coordination. And yeah, great teachers would be able to connect the two. Thank you so much for such wonderful answers, Toby and Geeta ji. Thank you so much for joining us today. This brings us to the end of the session. Dear attendees, I'll request you all to please share your feedback in the feedback link being shared in the chat box. This will help us to improve your experience further, to improve us in terms of events further. Thank you so much for joining us today. And also, if you are interested in attending the workshop series, the link for that workshop series is also being shared in the chat box right now. Thank you so much. Your final words about today's session, Toby. How do you feel?
Okay. What we have always felt is that all these when about ability, it has been a eye opener and a platform for both of us to get a huge audience. And about today's topic, I would tell, make sure that the child gets what they require and what is necessary for the child. That's what we always tell. And make sure you always review it also, because you can't always spoon feed a child for the whole lifetime. You would have to actually teach the child how to make his own food. So that's what I would have to tell.
Definitely, definitely. What a wonderful message to end the session with. Geeta ji, your final words.
Yeah, Toby has put it very aptly. Yes, we have to provide whatever it takes to help the child reach their fullest potential. We also have to just remember that when we give these support systems, many of these systems have to be weaned off also as and when necessary, so that the child becomes as independent as possible. The only thing to remember is SLD is a neurodevelopmental disorder, so it means that some of the support systems may not be completely removable. There may be some
Right.
systems or some assistive technology or something that the child has to have probably all their life. So it is how we judiciously plan for it, give it, and wean the child off it, or resume the continuance of a certain kind of support system, which is necessary for the child to achieve success in life.
Definitely. What a wonderful saying. Thank you so much for joining us today. Thank you, everyone. That brings us to the end of the session.